Alright, we're going to be doing a physical assessment today along with the 12 cranial nerves. Rebecca, our nurse, will assess the patient, Bob.
Hi, Mr. Mooring. My name's Rebecca. I'm going to be your nurse today. I'm going to give you a physical assessment and check your vitals.
Okay, hey Rebecca.
Let's just check your name, ma'am. Can you state your name and date of birth?
Bob Mooring, 10/13/1958.
Okay, and do you know why you're here today?
Just feeling a bit dehydrated.
Okay, and do you know where you're at right now?
High Point Hospital.
And the date?
It is March 5th.
The patient is
Alright.
alert and oriented ×4.
Alright, let me just go wash my hands. I'll be right back. Privacy.
And the nurse, Rebecca, will start with vital signs.
Alright. Check your pulse oximetry. Just relax the arm. Just lay it down and relax it. Okay, your pulse ox is 100%. That's good. Just going to raise the bed a little bit. Mm. 130/75. Just gonna check your pulse.
And she'll check the pulse for 1 full minute.
Alright, just put it across your stomach, please. Alright, his respirations are 18.
Alright, and now Rebecca will begin assessment at the head, checking the scalp for any bumps or lesions, abrasions, and any possible lice that could be in the scalp.
Any pain?
No pain.
Okay. I'm gonna have you take your glasses off, okay?
Okay.
She's going to start assessing the skin on the face, making sure it is the right color for his race, and looking at the symmetry with the eyes, feeling the sinuses, checking everything on the face.
Everything is symmetrical.
Okay, she's going to now look at the nostrils,
Can you look up for me?
making sure the septum is not deviated.
No deviation?
And while we are at the nose, we can check the first cranial nerve, the olfactory, and she's going to have the patient close the eyes and distinguish the smell.
Alright. Tell me what you smell.
Coffee.
Very good.
Okay. And now we are going to move to the second cranial nerve, the optic, and we will use the Snellen chart.
Will I have to put my glasses on for this?
Okay.
And the nurse will have the patient read lines of the Snellen chart.
What line is this?
That is the second line. It's P, Z, D.
The fourth line?
A, H, Z, B, D,
Fifth line?
S, T, Z, F, G,
And then this one last line.
Z, E, P, D, A.
Okay.
Now the nurse is going to assess for Perla, making sure the pupils are equal and reactive to light. And she can also assess to make sure there is a consensual response with the pupil reflex.
Follow the pin light.
Rebecca's now assessing for accommodation. And now that makes sure that the third oculomotor is intact with Perla. And now we can use the cardinal gaze 6 movements to assess for the trochlear nerve and the abducens nerve.
Very good.
Okay. And now the nurse will assess for the 5th cranial nerve, the trigeminal, using a cotton ball to touch the face and forehead, cheek, and jawline with the patient's eyes closed.
Can you close your eyes and tell me what you feel as I rub it against your face?
Okay. Forehead, cheek, and my jaw.
Okay. Now the 7th cranial nerve, the facial, can be tested by asking the patient to wrinkle the forehead,
Forehead.
smile, and blow out the cheeks. Okay. The 10th cranial nerve, the vagus, can be tested by asking the patient to open and say ah. And Rebecca can make sure the uvula is at midline.
Open wide.
And while the patient is sticking out the tongue, this also assesses the 12th cranial nerve, the hypoglossal. And while Rebecca's in the mouth looking, she can make sure that the oral cavity is intact and the teeth look good and are there. And while we're around the mouth and neck, we can assess the 9th cranial nerve, the glossopharyngeal, by asking the patient to swallow.
Can you swallow? Okay.
Okay. Now the nurse is going to assess for the 8th cranial nerve, the vestibulocochlear. She's going to snap the fingers near the patient's ears with his eyes closed.
Can you close your eyes and tell me where you hear the sound?
Okay. Here. Here. Straight ahead.
Okay.
And the 11th cranial nerve, the spinal accessory, tests the trapezius and the sternocleidomastoid muscles.
Can you shrug your shoulders for me?
Okay.
All right. Can you push against me? Push against me again. Okay.
Okay, the nurse is now going to visually assess for jugular vein distension, and we're just looking at the carotid arteries. She will now palpate the carotid arteries one at a time. And use her stethoscope to auscultate to make sure there is no bruit sound at the artery. And while at the neck, the nurse can assess that the trachea is midline. And also feel the lymph nodes in the neck, under the jawline. Make sure nothing is sore or swollen. And she'll continue down to the clavicles, just palpating the skin, making sure everything's intact.
No pain.
No pain.
Okay.
Now the nurse can assess the skin on the arms, especially checking the bony prominences of the elbow. And she can, while she's at the arms, she can assess the brachial pulses and the radial pulses bilaterally. We can assess for capillary refill, and they need to be less than 3 seconds. and also for skin turgor. And this patient might be sluggish since he is dehydrated. And now we need to test the strength of the patient's hands and arms.
Squeeze my hands. Push against me. Pull against me. Very good.
And now assess the active range of motion of the patient's arms.
Can you put your arm up and down, in and out, in and out? And bend at the elbow. Okay. Active range of motion.
Okay. Now the nurse is going to assess the chest area. Make sure there's not any pain or tenderness.
No pain or tenderness.
Okay. And now the nurse is going to assess the heart sounds. And we start with the apical pulse, or aortic pulse, and then the pulmonic, and then Erb's point, and tricuspid, and last the mitral valve, which is mid-clavicular line at the 5th intercostal space. And the nurse will listen for 1 full minute to get the heart rate. While we're at the chest area, we can listen to the lung sounds.
Take a deep breath and blow out like a candle.
We're making sure to hear the lung sounds are clear, and there is no fluid or producing crackles or anything like that.
And one more. Okay.
Next, we can move down to the abdomen. And we want to auscultate the abdomen before we palpate. We start in the right lower quadrant. And the right upper quadrant. And the left upper quadrant. And the left lower quadrant. We want to assess the bowel sounds to know if they're hypoactive, present, or hyperactive. If you do not hear a bowel sound, you have to listen for up to 5 minutes. And then we can palpate. Make sure there's no pain or tenderness for the patient.
Pain.
No pain.
Okay.
You want to assess eating habits and bowel movement as well.
Are you eating healthy?
Eating pretty healthy. Actually been on a diet here lately.
When was your last bowel movement?
Last night.
Okay.
You also want to assess about the patient's voiding patterns.
I'm typically pretty regular as far as my voiding.
Okay.
And then we can start moving down the legs a little bit, starting with the femoral pulses.
Okay.
And as we're moving down the leg, we can check the skin, especially checking the bony prominences for any, wounds or swelling. And while we're at the knees, we can check the popliteal pulses.
Bend your knee a little. Okay.
Now once we're down at the feet, we can assess for the pedal pulses on the tops of the feet. And assess for capillary refill. And the posterior tibialis pulses. We need to test the strength of the legs.
Pull against me. Push against me. pull your toes towards your head. Are you feeling any pain in your calves?
No, I'm not.
Okay.
That is assessing for the Homan sign. Make sure the patient doesn't have a DVT.
All right, can you bend your knees up? And can you roll over?
Okay.
Now the nurse is going to assess the patient's back. She can assess the skin, and then she will assess the lung sounds on the back.
Deep breath, blow out like a candle. Okay.
And while the patient is still on this side, the nurse can assess the sacrum and the buttock region and make sure everything looks good for the patient.
Okay, you can roll back onto your side.
So,
And that concludes the full physical assessment.
Is there anything else that you need, Mr. Moore?
no, I think I'm just fine, thank you.
Okay. So lower your bed. And here's your call out if you need anything.
Okay.
All right?
Thank you.